Are you worried about getting dementia or Alzheimer's disease, just like one of your loved ones has? Watching them deteriorate slowly over time, it's absolutely heartbreaking. They get to a point where they don't remember your name, they don't remember where they live. And ultimately, this is a big burden on everyone, and it's really hard to watch. Now, I strongly believe that most cases of dementia, with Alzheimer's being the most common type and vascular dementia being the second most common type, is actually a choice we make through the actions we take on a daily basis. What I want to do is I want to review some research with you about the cardiometabolic risk factors of dementia. So when I say cardiometabolic, I'm talking about diabetes, heart disease, and strokes. So I'm going to start by reviewing some research with you on this. And then I'm going to go through a few different things because I really want to tie this in a way that it makes sense. So what I want to do is first start off, okay, you know what? Here's a recent research paper that was done in Sweden. And what they were looking at was diabetes, heart disease, stroke, as which we already know are risk factors for dementia. And then they said, what's the difference if it happens early on in life versus later in life? Now, what they concluded was cardiometabolic multimorbidity. So this means if you've got, for example, diabetes and heart disease, that'd be a multimorbidity. Particularly in midlife, is associated with an increased risk of dementia. So midlife, 30 to 50 versus getting diabetes when you're 70. So this is a big issue, okay? And I'm not going to go scroll down here, but ultimately what they found was multimorbidity, it over doubled your risk of vascular dementia. And for Alzheimer's disease, it increased by 50%. So we really want to make sure we're taking this seriously from the beginning and we don't let it develop. That's one of the things is we play with fire. We think we're youthful, we're resilient because we were as teenagers. But then as we get into our 20s and 30s and 40s, our body can no longer handle everything that's being thrown its way. So we've got to change it. Now, there are some labs that you should be getting done. You should be looking at what's happening with your insulin, what's happening with your blood sugar, what's happening with your C-reactive protein. But on the insulin and blood sugar, don't only do a fasting one. That is very misleading. Your system has to have been broken down and stressed for a long enough period of time for that to be abnormal. I like knowing, where is it 1 hour after you eat? Where is it 2 hours after you eat? Is it coming back to normal? If it's not, that's a big issue that's predisposing you for stuff. Now, with most people who have heart disease and diabetes, they are on medications. What are those medications actually doing? So this was a research article where they looked and said, okay, what happens to the gut microbiome as a result of prescriptions? Now, this is not antibiotics. These are just regular prescriptions. Now, what you'll see is these are many medications that people are routinely on. Proton pump inhibitors. So this is your Nexium, your omeprazole for your stomach acid, metformin, kind of first line therapy for diabetes or even for people with PCOS. NSAID, so this is going to be your ibuprofen, your Aleve, your opioids, statins. Once again, if your cholesterol is elevated, LDL, you've got diabetes or even hypertension, a lot of people are being put on statins, and then antipsychotics. Ultimately, I'm not going to go into this whole paper, but all of those were impacted. So non-antibiotic prescription drugs have a notable impact on the overall architecture, so the makeup of the intestinal microbiome. So this is a really big issue. So if you start altering the microbiome, what can happen? Well, it ultimately can create a lot more inflammation. And that's where we go here. We look at proton pump inhibitors in those with diabetes and cardiovascular events. Now, this was a study where they followed people with type 2 diabetes who were doing PPIs over an 11-year follow. A 27% increased risk of coronary artery disease compared to those that didn't use it. So now you go from a single morbidity of diabetes to a multimorbidity because of diabetes and what that's doing with, usually as a result of your eating habits, you're now getting heartburn, you're taking PPIs, which is now giving you another morbidity. Um, Also, PPI's 34% increase in myocardial infarction, 35% in heart failure, and 30% in all-cause mortality. So this is a really big deal. And unfortunately, we're usually not handling this the way and it should be. Most people say, okay, well, I'm eating. I don't want to change what I'm eating. And so they're doing stomach acid blockers. But what you really need to be thinking is if I need a stomach acid blocker, I need to step back and realize that something's off and I need to change my nutrition. I always try to do things based upon the fundamentals of health: how you eat, sleep, stress, exercise, and socialize. Those 5 rules. If those are going the way they should, that's where I bring in stronger things. I start with doing nutritional supplements, and then I've got things stronger than that. And I don't go to medications unless I absolutely need to, because there's so many trade-offs that we get. And going back to the very beginning with the premises, I don't like getting patients who come in with very progressive dementias because there's really nothing that can be done. Maybe we slow it, maybe we, keep them where they're at a little bit longer. But there's so much that you can do in your 20s, your 30s, your 40s, and 50s to prevent that from having to become your reality. And knowing your cardiometabolic risk factors is absolutely essential to do that. Don't stop at a standard lipid panel with your cholesterol and triglycerides. Don't stop with a basic blood sugar. There's a lot more information that can be garnered with the labs that are routinely available. And with that information, you can get a much better idea of what your risks truly are. Because once again, I believe dementia is a choice. If you'd like to learn more about how to work with me, which is more in general, here's how to contact me. Visit idahobrainandbody.com. And I hope this has helped you get to a spot and you act on this information. It's just not something else you've consumed, but it actually can change your life.